Okay, so my patient's ears, I didn't notice any redness, any swelling, or any form of discharge or exudate. I also see that patient's ears are intact with pearly gray tympanic membranes. Okay, and so next I'm gonna go into my patient's nose. Okay, I'm gonna take a look into my patient's nose, ensure the nasal septum is midline, um, check for any redness, any swelling, any form of drainages in his nostrils. I could ask check for patency by having the patient close one nose and breathe, and ask the patient to close the second nose and breathe, just to make sure the patient is able to breathe normally on with both nostrils. Okay. I also see that patient's nasal turbinates are also intact, and there is no inflammation or drainage in there. Next, I'm going to have my patient open his mouth by saying ah, and I'm going to take a look at the oral mucosa and make sure the patient's mouth is pink and moist. I'd also check the patient's uvula to make sure the patient's uvula rises and falls like symmetrically. I would also look at the patient's soft palate and make sure it's also, see how it moves as well while the patient's mouth is open. And I don't see any form of redness. I could check for dental caries, ensure patient's dentition is actually intact. Like patient's teeth is actually also intact. I would also check for patient sinuses, check for sinus pain, just right above the patient's eye, underneath the eyebrow. Just press in and up, and then I'm gonna come down all the way to like the cheekbone area and also palpate, just as just check for any form of any swelling or any form of like complaints of pain or anything going on there. Okay. In the patient's case, it's all intact. Also, the throat, I check patient's throat. Everything seems moist, pink, and I don't notice any form of issues. So next, I'm gonna check for patient's lymph nodes on the neck. Check the patient's head and the neck and just palpate for any form of lymph nodes. So I'm gonna check usually from the back of the ear to the front. Just palpate down underneath the chin, the jaw, the neck, above the clavicle, palpate above the clavicle, and also below the clavicle. I don't feel any nodules when the patient doesn't. I don't see any form of distress in my patient as well while I'm palpating. Okay. I'll also, while I'm checking the patient's neck, I would also check the carotid pulse, and I could also auscultate with my bell to check for breaths. Okay, and I didn't notice any breaths there. Patient's trachea is midline. Patient's thyroid isthmus is also midline. Those were palpable and not enlarged. And the neck was also very supple. I didn't notice any goiter either. Okay, and then we're gonna go to respiration. Okay, but before I go to respiration, I could also check for the patient's range of motion of the neck. Okay, ask the patient to turn the neck from side to side. Make sure the patient is able to move. I could also have the patient shrug his shoulders, apply some pressure to see how the patient's shoulder muscles also function as well. Okay, and then I'm going to go to respiration. As I see my patient is in any form of distress, respirations are within normal limits. I'd say patient's respiration rate was maybe 18, which is within normal limits. Patient seems comfortable, so I'm just going to auscultate to listen to my patient's lungs. Okay. I don't notice any use of accessory muscles or anything, no form of labored breathing or anything. Patient's very comfortable. Okay. I'm just going to listen to patient's lung sounds anteriorly and posteriorly. at this, I'm having the patient take deep breaths when they hear my stethoscope. And I'm also going to do that posteriorly. You can take deep breaths in and out, from side to side, in and out, in and out. Okay, so lung sounds are clear bilateral posteriorly, and anteriorly I don't hear any wheezes, rhonchi, or crackles present during auscultation. And lung sounds are not diminished in any way. I didn't notice any absent lungs or diminished lung sounds. So all lung sounds are clear. I don't notice any issues with my patient. In my patient's case, they're all within normal limits. Okay, so cardiovascular, assessing the heart. So I'm gonna also auscultate and listen to my patient's heart sounds. Check, make sure there are no any extra heart sounds, any murmurs or palpitations. Okay. And we had also checked the patient's carotid pulses, and there are no bruits. There's the aortic valve, pulmonary valve, Erb's point, pulmonary valve, I'm sorry, aortic valve, pulmonary valve, Erb's point, tricuspid, and then the mitral valve. Alright, I'm gonna listen properly by using my bell. Mitral, tricuspid, Erb's point, pulmonary valve, and aortic valve. Okay, and I did not hear any abnormal heart sounds. I also listened to my patients the PMI, the pointer for maximum impulse, which is also the apical pulse, and it was like 86, and it was regular in my patient's case. Okay, so I'm just going to go to assessing patient's chest and thoracic area. Okay, as I see my patient's thorax is actually symmetrical with good expansion. The lung sounds were all clear with no abnormal lung sounds. The diaphragms would descend symmetrically, and I could also check as the patient take deep breaths in and out, and make sure patient is also breathing symmetrically. The breasts are symmetrical, smooth. I don't feel any masses. I don't see any discharges, and the thorax area seems also good and within with no any form of issues. Okay, so next we're gonna go to checking the gastrointestinal. This would be the assessment of the abdomen. I could ask my patient, when last did you have a bowel movement? Any abdominal pain or anything? Any form of discomfort in the abdomen before I perform my assessment. I'm also gonna take a look at my patient's abdomen. Make sure, just check for peristalsis. I'll check for any form of pulsations. Check for skin color. Make sure there are no lesions, no rashes, or any abdominal incisions or anything, or wounds or anything in the patient's abdomen. And in my patient's case, everything seems okay, and no issues noted here. So first of all, I'm going to auscultate, listen to my patient's bowels. I'm going to listen to the 4 quadrants and make sure the patient's bowels are not hypoactive or hyperactive, and they're just normal, have like regular bowel sounds. Okay, so I noticed that patient's bowel sounds are active, and no issues there. So I'm going to go and palpate and just check for any form of masses in my patient's abdomen. Okay. All right. So I'm just going to tell my patient I'm going to just palpate lightly. Okay. So Mr. Teddy, I'm just going to palpate your abdomen lightly. If you feel any pain, just let me know. So I'm just going to palpate in a circular motion, just gently round. While I'm palpating, I could also go in on the patient's ribcage and also check for any liver enlargement. In this case, I don't really feel anything. Could also go and also check for the patient's spleen and make sure patient's spleen isn't enlarged. In this case, I don't feel it. And I could also go and palpate for my patient's kidneys, make sure the kidneys are not also enlarged. And I don't feel any pain as well. Patient isn't complaining. Patient seems comfortable and in no form of pain, and I don't feel the patient's kidneys in this case. But have my patient go back and also check for severe tenderness and ask the patient if he feels any pain, and I'll do it on both sides. And I don't feel anything, and patient doesn't feel anything. So in this case, my patient's case, a normal, within normal limits. I could also auscultate for bruits in the aorta, the kidneys, like the renal arteries, and I don't hear any bruits in this case. Okay. All right, so we're gonna go to the GI. That's gonna check for any inguinal adenopathy, just around the inguinal area. Yeah, everything seems smooth. I don't feel any masses or nodules, so that seems good there. I could check patient's genitalia for lesions or masses. Check for pain. Check for discharge. Also assess patient's urine as well. Make sure patient's urine doesn't have any smell, any odors, or anything. So in this case, it was within normal limits. So go down to the lymphatic area. As at the beginning, I did assess for the patient's lymph nodes, the head, the neck, and also around the axilla area and also the inguinal area. Like no form of lymphadenopathy noted. They were not palpable, so the nodes were not palpable. Most of those that were palpable were really smooth, soft, and movable. Okay, and they kind of like had the bean shape. They were all like bean shaped. Okay, I'm gonna check my patient's musculoskeletal area by checking the patient's range of motion. Okay, I could check the patient's strength by having the patient squeeze my hand, have the patient, make a fist, pull away while my hands are with resistance, push and pull to check my patient's strength. I can push against my patient's foot and have the patient push against me, things like that, to check for my patient's muscular strength. And in my patient's case, patient's strength is 5 out of 5. Okay, I could check for sensation. I could ask the patient to close his eyes, and I could touch the patient and ask the patient where the patient actually feels the sensation, and the patient would go ahead and tell me where exactly he or she has the sensation. I could also use a needle to do a pinprick, so the patient can be able to differentiate where he or she actually feels the pain. So in my patient's case, I don't notice any weakness, no redness, no edema, no petechiae noted on any of the extremities. I could check for patient's reflexes. I could use my stethoscope in this case and see the patient's reaction and test for the patient's reflexes, and just below the kneecap, just pretty much around the kneecap area, to check for the patient's reflexes. And in my patient's case, they're all intact. I could ask my patient to also take a walk around the room just to access my patient's gait and patient stance. I could ask the patient to walk on his toes and see how he's able to walk with that. Ask the patient to walk on his heels and assess how my patient walks. And in this case, my patient was able to walk around the room and around corners, walk on his toes and on his heels without issues. He had a normal gait, balance, and coordination. No form of pain or tenderness noted. Tenderness noted while he was walking. I would also assess my patient's spine, make sure it's actually symmetrical. While I palpate, make sure patient doesn't have any pain or tenderness during that as well. I'm also going to go to my patient's skin, which I had pretty much done at the beginning. Patient's skin is even. I didn't notice any form of rash, petechia, ecchymosis, lesions, masses, or discoloration. Patient's skin is intact and is appropriate for his ethnicity. No, I didn't notice any swelling or any form of drainages on any part of the patient's skin. No incisions, no form of wounds. Yes, the patient's skin is intact. And I'm going to go to the neurological aspect of my patient. In this case, my patient's alert and oriented. He's relaxed. He's calm and cooperative. His thought process is coherent. He's coherent. His reflexes are +2. I was able to assess my patient's gait, which was stable. The patient was able to maintain balance. I also did the Rombeck's test to make sure to assess for patient's balance with his eyes closed, which was intact. I tried the pain prick and I also checked for sensation, and all that is within normal limits. Okay, so for psychiatry, we're gonna check and see. As I can see, my patient is alert. He's well groomed. His speech is clear. His words are clear. Thought processes are coherent. His insight is good. In this case, I could ask patient to do additions and multiplications. I could maybe ask the patient to do the serial sevens. In my patient's case, it's actually accurate. Just to make sure, just to check for patients, assess patient's mentation. Ask the patient if patients had any history of any psych issues in the past, any form of depression, any stress-related events. That is, maybe it could be bordering patient is anxious or anything. But in this case, my patient appears alert, oriented, and calm. And this comes to the end of my presentation. Thank you.